Have you ever felt like you were so scared to the point that the fear stopped you from doing the things you normally do on a daily basis? If yes, know that we understand how much of an isolating feeling it is. It does not feel good that the only thing holding you back is fear, and sometimes it even makes you feel like you're going crazy. If you relate to the descriptions but do not know what exactly is happening, you might want to look at agoraphobia. That will be our topic for today's Inspiration Calling video. But before we even get there, help us grow our community by subscribing to our channel. This is a safe space to learn more about you, your personality, and anything involving psychology. Please don't forget to click the notification bell too so we can notify you whenever we upload new content. If you're done with that, let's get straight into the video. To put it in simpler terms, agoraphobia is a type of mental health condition that pushes you to deeply fear specific situations to the point that you resort to avoiding it and even not leaving your own house. You feel like your fear and anxiety get too overwhelming that you no longer feel like escape or help is possible. Usually, this causes the person experiencing this to avoid situations like large and open areas, enclosed spaces, crowds, places outside their home, and even transportation. Agoraphobia affects the daily lives and activities of those who experience it to such a high extent that it is already considered as a type of anxiety disorder. Researchers are still on the way to finding the real cause of this extreme fear, but their current data shows it is often linked to panic disorder. When someone has a panic disorder, it is common for them to experience short and intense attacks of fear, even without any trigger. This usually develops into agoraphobia that almost a third of those with panic disorder have it. But this is only in some cases. You can still not have panic disorder and still experience agoraphobia. Now that we have discussed the general definition of agoraphobia, it is time to go to its symptoms and causes. As humans, it is normal to feel anxious or nervous about some things sometimes. Naturally, if you are taking an important test, you will get anxious because you know how much of your future depends on it. However, this anxiety is already classified as a disorder if the extent of which you are experiencing it goes beyond the normal rate. Always remember that it is not normal to worry all the time that it affects your daily activities already. In the same way, agoraphobia makes you avoid certain situations because of the extreme fear and stress it causes you. Although it shares the same symptoms with a panic attack, they are two different things. To help you determine if what you are experiencing may be agoraphobia, here are some of its symptoms. But before we go there, let us give you a quick disclaimer first. This video is not meant to replace the job of mental health professionals. Please do not use this to self-diagnose or to label other people as such. If you identify with any of the symptoms, it is best to consult a doctor so they can give you proper diagnosis and medical advice. Usually, people with agoraphobia get so afraid of going outside their comfort places or homes for long periods of time. They will also not like it if they are left alone in a social situation because they feel like they will lose control in public places. If you take someone with agoraphobia to somewhere unusual to them, expect that they are already thinking of an escape route. This is why they will feel uncomfortable in places where it is difficult to escape, like cars and elevators. These situations can cause them to feel anxious and agitated. Just like what we said earlier, agoraphobia shares similar symptoms with panic attacks. It also happens mostly to those with existing anxiety disorder or other mental health issues. When someone experiences panic attacks or agoraphobia, they usually have these physical symptoms ranging from mild to severe: chest pain, a racing heart, shortness of breath, dizziness, trembling, choking, sweating, hot flashes, chills, nausea, diarrhea, numbness, and tingling sensations. It is also worth keeping an eye out if you have been going through a stressful life event like a death of a loved one, assault or abuse, and any other traumatic events, especially in childhood, since it raises your risk of developing agoraphobia to a much higher rate. Women have agoraphobia more frequently than males do. It typically starts in adolescence, with onset occurring on average at age 20. Yet the conditions, signs, and symptoms might appear at any age. Just like any other mental health condition, agoraphobia is diagnosed through a series of queries and tests. If you feel like you may have one, it is always the best choice to check with your doctor or any mental health professional that you trust. Given that the agoraphobia you might be experiencing makes you fear going outside your home, you may want to opt for a teleconsultation or checkup through calls or video calls. During this time, your doctor may ask you a series of questions pertaining to your fears, what you think are the causes, and even the extents of it. Based on your symptoms, how frequently they occur, and how severe they are, a medical professional can determine whether you have agoraphobia. It's critical to communicate openly and honestly with your providers. If you meet particular criteria specified by the American Psychiatric Association, your doctor may make the diagnosis of agoraphobia. If a person has significant fear or panic in at least 2 of the following circumstances, they are said to have agoraphobia: using a public transport system, being in a public area, being in a closed-off area, being surrounded by people or in a line, leaving their house alone. A diagnosis of panic disorder and agoraphobia has additional requirements. You must experience panic episodes on a regular basis, and at least one panic attack must be followed by a worry of experiencing additional panic attacks, fear of panic attacks' outcomes such as suffering a heart attack or losing control, a modification of your actions as a result of the panic episodes, and if another condition is the root of your symptoms, agoraphobia won't be labeled as such. Moreover, neither drug use nor another condition can be the root of them. Let's say, for example, you really have agoraphobia. Do not worry too much. This is not the end of all your life. Yes, you need to acknowledge that it is real and it is a heavy burden to carry, but you are not a hopeless cause. There are things you can do to improve your situation. Here are some of the treatments or medications your doctor may prescribe you. 1. Psychotherapy. You can conquer your fears with the aid of a therapist. A mental health care professional can assist you in identifying the thoughts that make you anxious through cognitive behavioral therapy. After that, you'll discover how to respond more effectively. Your healthcare professional could ask you to visualize a terrifying scenario and learn to control your emotions through relaxation and desensitization strategies. You'll eventually be able to engage in anxiety-provoking activities and develop emotional self-control. Therapy can gradually change the way your brain thinks and behaves. 2. Cognitive behavioral therapy. The most popular type of psychotherapy used to treat agoraphobia is cognitive behavioral therapy. CBT can assist you in comprehending the erroneous thoughts and sensations linked to agoraphobia. It can also teach you how to handle challenging circumstances by swapping out unhealthy thinking for good ones, giving you back some sense of control over your life. 3. Exposure therapy. You can overcome your worries with the use of exposure therapy. You are exposed to the places or circumstances you are afraid of in this kind of therapy, gradually and gently. With time, this can cause your dread to lessen. 4. Medications. Moreover, your doctor might advise drugs known as selective serotonin reuptake inhibitors, or SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs. These drugs can be used to treat anxiety and depressive disorders. 5. Lifestyle changes. In combating agoraphobia, your lifestyle can play a vital role too. If you want to lessen its symptoms, you can try to change the way you eat, your activities, and how you approach life as a whole. It is better if you avoid alcohol and anything that has caffeine in it. You should also eat healthy so that you can eat a well-balanced diet. To keep your mind off of your thoughts, you can also use exercise. It does not matter what exercise you do as long as you enjoy it. You can even add breathing exercises to it. If you have been diagnosed with a mental health condition as well as agoraphobia, it is important to remember that although you acknowledge what you are going through, you do not let yourself get drowned by it. Now is your time to take good care of yourself. If your doctor has prescribed you medication, remember to take it on time and develop habits that help you be better. Aside from that, remember that it is okay to feel nervous or anxious, but these things should not stop you from doing what you want as long as it is safe and legal. You can experience anxiety and a sense of loneliness, but you may control the symptoms and enjoy a full life with treatment. Speak with a healthcare professional if agoraphobia or any anxiety problem impacts how you live. Help is always there for you. That's it for today's video. You can leave any of your questions, suggestions, or reactions in the comments section below. We'd love to hear from you. Also, don't forget to hit that notification bell so you can get notified whenever a new video is up. Until next time, thank you for watching.